Hello there, we are live from our studios here in Kokomlimle. Digital address GA099-2539. Our lead stories this hour. 5,786 people are currently COVID-19 active as we speak, with 433 killed so far. We update you as some 40 fresh cases are reportedly recorded in the eastern region today. We have boots on the ground. A worrying trend of more children testing positive for COVID-19, raising fears not had earlier. But to what extent are these fears founded? And are we just realizing this trend now because we're testing children more? We'll pursue some answers from pediatric experts, even as people are reportedly being killed by post-COVID-19 complications. Also coming up, 4 persons critically injured in yesterday's accident in Bipe, battle for their lives in hospital as families go livid. 18 bodies so far. 10 of the bodies have been claimed, 4 identified but unclaimed, and the remaining 4 yet to be identified. We are in the region for updates. And the pulse is brought to you by Global Communities Dignelu, affordable, safe sanitation. Join us on DSTV 421, GoTV 144. We're streaming live on YouTube and on our other social media handles. Our WhatsApp number 0540-109009. My name is Gifty Andwapia. This is The Pulse. Please be my guest. You're welcome to the details now. Doctors treating COVID-19 patients are getting worried by the day over cases being reported in children, the latest being an 8-month-old baby and a 1-year-old boy. Last week, we brought you a report from Komfanochi Teaching Hospital where healthcare givers are raising these concerns. In 10 days, 9 children at the facility tested positive for the virus, while the youngest among them is an 11-day-old baby. The eldest is 14 years. Just yesterday was when we brought you that story from Tamale Teaching Hospital where that 8-month-old baby also tested positive for COVID-19. Now, how does the disease manifest in children? And are you worried as a parent or a guardian? What should you look out for? Like I said, you can send us a message on our WhatsApp number, but do stay tuned for the conversations. Now, we'll talk about the case management as we go along, but let's bring in Dr. Lawrence Osei-Tutu, who is a pediatrician, who is joining me right now via Zoom. Now, the number that you can send us your questions, if you do have any, within the time that we keep Dr. Osei-Tutu on, is 0540-109009. That's 0540-109009. In the meantime, I'll try and ask the questions, assuming that I know what's on your mind. Doc, thank you very much. Good afternoon.
Good afternoon.
So we're looking at what looks like a rising number of COVID-19 infections among children. But yesterday I spoke to the Deputy Public Health Director of the Northern Region, who indicated that the possibility that we are now seeing this because we are now beginning to test is high. What do you think is revealed in the trend we are seeing so far?
Well, we learn every day and we keep learning about this disease. So in the so-called first wave, some months back, what we realized was that children were not getting sick. I mean, let's be clear about that. They were not getting sick doesn't mean they were not harboring the virus. So what it meant was that a lot of the tests that were carried out, presumably, were done in people who were sick, who happened to be adults. And then we happened to find some in children who had come also very sick in many of our hospitals that treat children. So, I mean, there could be a lot of factors. People who are experts in studying numbers and the disease trends, whom we call epidemiologists, sit down, then they look at accumulated data over time. They look at the numbers, they draw inferences and conclusions based on some form of associations. And then they advise all of us, you, the public, myself in the clinic, based on the numbers that they've been able to gather and look at. So in this wave, I haven't seen a clear official communication from the public health experts as to what the trends are in the case. It could well be true that, yes, we are testing more children now. It could also be true that the season which we are, remember this time is the season, if I'm not, November, December, January, is where children have a lot of respiratory tract infections, pneumonias, in the past diarrhea and vomiting. So you'd have children coming to hospital with other illnesses anyway. But because we have an epidemic full-blown and in a second wave, obviously, clinicians would also be sure, would want to be sure that there isn't a contributory factor from COVID, or that it is not COVID showing itself in that manner. So we are still learning. So I can't say, I'm not an expert in the field of COVID to tell you that for sure we are seeing a higher number. I take advice from you based on the information you have shared, that it appears that you are testing more. And so it will be true. If you do test more, you tend to find more. But I mean, the second wave is obviously showing characteristics that are a little bit more aggressive than we used to see in the beginning, the March, April, May, June wave.
So, I mean, for parents are obviously worried. What can you do? I mean, what are the basics when it comes to protecting yourself and your children? Because the likelihood that when parents get it, especially mothers, it will transfer to their little children is very high. And like you said, we're dealing with a rather, aggressive strain of the virus, it seems. Now, what are the basics in terms of how you can protect your children?
So we move from the known to the unknown. The known about this epidemic, or about SARS-CoV-2, the virus, is that if we stay away from each other, we are likely to limit the chances of spreading it amongst ourselves. That remains the key thing. And then if you wear protective equipment like a face mask, the likelihood that even if you had it, you will limit the chance of spreading it. It gets better if the other person is also in a face mask. Even much better if you are not indoors and you are outdoors. Fantastic if you are even not in a crowd at all. So the basics are there. And now, to further limit the opportunity of you contaminating yourself from your hands, then the recommendation is that keep washing your hands with soap and water as much as possible. And try not to touch your mouth, your eyes, and nose. I mean, I can't, that one is difficult. So sanitize and or wash your hands with soap and water to limit the opportunity of transferring the viruses from your face mask, from other persons, onto your face, your nose, and your eyes. That, we believe, is how the virus gains direct entry into its most preferred site in the human body, which is your nose, your eyes, your throat area. So those are the principles. So that is exactly what we must do, be it a child or adult. So in the healthcare setting, especially in our public healthcare delivery setting, and unfortunately for a developed country like ours, where we do not have, I'm not sure I can count more than 2 public healthcare delivery setting that is specific for children. I'm talking about a pediatric hospital or a child care hospital. We do not have that. So we share that with adults. And that's a frustration. So I meet people who say, oh, you are lucky, you are seeing children. So you are not likely to get this infection. And I laugh because I see the child and I see her mom, sometimes her granny, and they are all crammed together in this small space. They give us some small, tiny space as part of the adult hospital. Just like when you go to church, there's a magnificent building, church building, and then the children go to Sunday school under the tree. It's the same attitude we have in our healthcare system. So there's overcrowding in the hospitals, and you have a small consulting room with a doctor, sometimes a nurse, a mom, and then sometimes the mom is bringing 3 children and they all have to cram in this. And these overcrowding situations, that puts everybody at risk, puts myself, because I have to also come back home to my family and there are kids here. And it makes it more challenging. I want to say difficult, more challenging when you have kids of different ages. Even adolescents are difficult to manage because they don't stick to the rules. And younger children, less than 3 or toddlers, don't even have any rules to obey in the first place. And those 1 to 5 years are all over the place. Okay, so they may try to stick to the rule, but after 30 minutes, their attention gets off to something else. So that calls for more responsibility on monitoring by parents, by adults, by other caregivers to ensure that our children are safe. And it starts with the adults this time. So the adult now has to make sure he or she is absolutely well and taking care of him or herself so that he doesn't transmit it to the child. So it's the basics. It's just proving hard to do because for once in our lives, the responsibility is not on somebody else to keep ourselves safe. The responsibility is on ourselves as individuals to keep ourselves safe. And that is proving difficult to do. It only says how indisciplined to some extent we are as adults, don't you say?
You talked about children. I mean, I have a friend who loves to take care, a doctor friend who loves to take care of children, and he tells me anytime there are children in his consulting room, they are touching everything in the room. They want to touch everything and experience everything in the room. So I can understand the challenges that you would go through then. But then we're even looking at much smaller babies, 8 months, 11 days, for example. For an 11-day baby, they can't wear masks. You can't put sanitizer on them. I mean, I don't know. Is there any way at all to handle a situation like that?
One. The question is, like I said, somebody must sit back, and the epidemiologists will do that and look and understand the how, the why, the when, and the where this infection, took place, so that we can better understand what happened in the first place. You cannot deal with something you do not know. So I'm sure people are busy crunching the numbers behind the scenes. People are looking at the people who handle these particular children must come forth immediately in the scientific world. They present the cases that they've seen. That's how they call it. That is the story of these patients, describing the where, the what, the why, and the hows to people. And they sit back and then look at it and they decide that, oh, this is probably what happened in these cases. Then we will understand better how to prevent it in such a young child. So you are right. I mean, I think WHO does not even advise that we mask up children who are less than 2.
Yeah.
So we need to find a better way of dealing with it. It starts with understanding how they first got it and why they got it. And the fact that you have found it in that 11-month or 8-month or whatever age you said it was, what does it mean? You and I, we could have TB organisms in us. In fact, we do have TB organisms in us, but we are not sick from TB. So the fact that the infant is carrying the virus does not mean he has the disease. So we need to understand that as well. Was the infant having the disease, or we just happened to by chance look for it and found it while he had some other thing? So I do not have all the information. So that is why it takes a lot of effort, painstaking. You need to be very diligent in that and find out the right things and the right answers to be able to prefer long-lasting solutions. Unfortunately, I mean, you cannot rush these things. So let's hope and pray that the solutions come out very soon. So I cannot sit here and say for a newborn baby, do this or do that. What the first wave taught us was that certainly the virus didn't seem to get transferred from a pregnant woman to her unborn baby while the baby was inside her womb. And the virus was also not transmitted through breast milk. So we as pediatricians and Pediatric Society of Ghana encourage breastfeeding moms to continue breastfeeding, but the mom should wear a mask, a face shield, and sanitize. And if she's sick, she should be on treatment and stuff like that. So we do not advise that you take infants and newborn babies away from their moms in such a situation yet. But like I said, we keep learning.
Electrician like you, what would be your realistic, and you've laid down all the challenges, you've laid down the feasibilities here, I think, but what will be your most realistic expectation of our health managers? I mean, those in charge of healthcare in the country.
Well, I think we could work more closely together. I think the communication aspect, the dissemination of vital information, so-called risk behavior communication, behavioral change communication. I might be wrong. It is all well and beautiful to have press conferences in the beautiful city of Accra in unblemished English, but I do not really. Have we studied the impact of that way of communication in the real world setting? I'm not sure that at the Touchless station the message is really going down, or even at the church, where my parish, or even at the market square, or in our schools among our teaching staff. Because, I mean, people point accusing fingers at rallies and parties and so forth. But we are the same individuals, aren't we? We are the ones who go to the market, who go to the party, who go to the church, who visit the hospitals. So the information is not going down well, right? So we need to understand better whether we are choosing the right platforms in communicating with the populace. And that worries me a little bit, that I don't think... You could have the message to share, but listen, the jargon with which a market woman or a trot mate will share that message with his colleague, for his colleague to adapt that message and use, is different from me or say to sitting on TV and speaking like a professional. You need to pick that trot mate, tell that trot mate in some kind of a training that this is the challenge. We want you to tell this message to your colleagues back at the station. Can you form this message in a way they can understand and share it for them? Also, yes.
Hello, Doc. Yeah, it looks like someone probably called through the phone, and so we'll get him back shortly. But the point that he was making is that it is about trickling down the information, the communication that will help people stay safe. He says that seems to have been centralized. Information flow seems to have been centralized at the very top here in Accra. He thinks it must be circulated all the way down, and he gives a very great example by saying that you can invite a vehicle, a conductor in a trotro, for example, a mate in a trotro, and ask them to break down the message, a market woman, and ask them to break down the message to their colleagues. Some of you have been sending in your questions and your thoughts. Let's go through some of them. This one says, I'm of the view that children are not spared in the second wave of this COVID-19, but since your guest uses data to make informed decisions scientifically, he is not able to confirm that children are prone to the second wave COVID-19 outbreak. Emmanuel Ejay Boateng in Kumasi, Ebuakwa sent it. He says hashtag the polls. Thank you very much for watching. This one says, please, pupils in the Upper West region have not yet received the nose mask. I mean, basic school pupils. Check it out from Rafiq Salam. Leferi from Magu sent that one. Thank you very much for sending in your message. And this one says, Adam from Tabali. Okay, you're asking about Evans. Evans is good. He's well. He'll be in soon. Okay. Well, let's see some of the messages coming. This one says, I think beyond the safety protocols that government has put in place, we should ensure that strict adherence by forming COVID-19 task force in all MMDCs across the length and breadth. In all MMDCs, sorry, I'm reading your message and I'm not getting the arrangement properly. So let me take it again. He says he thinks that beyond the safety protocols, there should be strict adherence by forming COVID-19 task force in all MMDCs across the country. And across the length and breadth of the country. Francis Standard from Koforidua. Francis, your message has got my tongue twisting, but thank you very much for sending that in. Okay, this one says, government must do something about it. Says teachers are a bit scared. We teachers are a bit scared. Government must do something about it, from Bibiani in the Western North region. Idrisu from Techima says, is it advisable for kids to use face mask? Well, there's already an answer. The WHO has indicated that it's not very advisable, especially for children below 2, like the doctor that we're just speaking to, the pediatrician we're just speaking to said. So there you have your answer already on that one. More of your messages. Good afternoon, Gifty. This one says, please, we need your cameraman in Sene West, Kwame Danso, of the Bono East region, to help save the lives of people from this virus, because 1, there is no effective nose mask wearing. Samples are being taken, but no money to fuel the vehicle to send the samples to the College of Health at Kentampo for testing. And there is inadequate PPEs for health workers. Thank you. Name withheld for confidentiality, he says. Thank you very much for sending this message. So let me check out the region again. Kwame Danso, that is Sene West. We'll reach out to our correspondents there, Sene West. I'll make a mental note of that. This one says it's unfortunate this time when children are back in school, while the COVID-19 virus is spreading fast among children. So one of the things we're trying to get also is whether or not, pediatricians will recommend schools, continual functioning. That might be a tough one. Doc Lawrence is joining me on phone now. Doc, are you there?
Yes, I'm here. I can hear you.
Great. So I'm just reading a message from someone who is asking whether or not it's good to stay in school now that the children have had to go back, and we're seeing this second wave, which you describe as a lot of unknowns. What will be the most feasible recommendation by a pediatrician like yourself?
Well, so this will be my opinion,
sure.
And my opinion will be that it should never rest with a single expert's opinion. That's the greatest mistake would ever commit. It should continue to be a stakeholder decision involving parents, involving teachers, involving advocates for children like Pediatric Society of Ghana, the pediatricians. We all have to, the public health experts, and then we all have to sit around, but you cannot do that without having some kind of baseline data, experiences to learn from. And luckily, we have experiences from other parts of the world. We have our own local experiences when we sort of had that mock examination with a smaller number of students going back to school.
Mm-hmm.
If you remember, with those having to write their final exams and the rest. What were the lessons learned? What advice did we glean from that? And did that go into the school reopening this time? And then as the school reopening is happening, I pray that there's continuous, learning process where we gather data, we gather information to be able to help us arrive at that answer, which is, should the kids be in school or not? Should they be there, but should we vary how long they spend in school? Remember, the more you are able to stay apart. So if you keep moving from each other, it's much better. So the longer you keep staying at one particular area in a gathering, the higher your chances. What says that when they are out of school, they are coming to stay indoors at home? We all think that, forgive me, that all these children are coming from nuclear homes where they have 5 bedrooms and staying in their own bedroom. No, the majority of Ghanaian children would rather be in school, because when they go back to home, there's no home to go back to. They are probably sleeping in 20 in a room and 10 in a room and so on and so forth. So we really need to dispassionately look at the evidence and be advised by it. That's what I would say. I will never be the first person to say, based on my expert opinion, this is what I recommend. That would be it. That's how I'll come.
I see. I see. Well, I was hoping to be able to get some of the questions, but I think most of the questions that have come in, most are comments. But for the questions that have come in, you've largely answered them. Is there a way that teachers can also? Is there an advice you can give teachers who are handling these children in school, and teachers who are perhaps handling some of these children in church at the Sunday school in those small spaces you described earlier?
Well, for me, when I last spoke with a group of teachers, what I told them was this: that it's like having an accident, and first aid. The first principle is that you, the person going to help them, must first ensure that you are safe. So you, the teacher, you must ensure that you are safe. But it is so deceptive, and that is how the cases are rising. It is so deceptive that we feel comfortable around familiar people. So when you go to work, you feel comfortable around your workmates.
True. And
that is where the gathering, the kissing, the hugging, the fist punches. Oh, let me take off my face mask. Let me look at the color of your lipstick today, and so forth. And that is what happens. So for teachers first, your common room, if your common room can be under a tree at this time where there are no rain, I think your common room should be relocated to under a tree. This is a situation where schools under trees are much better than air-conditioned room schools. Okay? So make sure that you yourself lead by example as teachers. Don't stand and be chatting when you have nothing to do, so that your students, your pupils will see that when you next tell them to move, they will move. Then allow the students and the people themselves to propagate the message. So if they've heard about washing hands, if they heard about not staying distant and so forth, can you have a class, an art class, for instance, where they express these things in art and put it as messages around the school as reminders for all the students? And truly, if your school is so endowed that you can do 3 days out of a week or 2 days out of a week and the rest online, consider that as a school. I don't think the GES will frown upon that. Okay, so the schools which are well endowed and can do that should do that. And then the schools that are really crowded, like my school that I attended, the Saitos, then we should bring back the shift system. Okay, so that we allow a smaller number of children to come per, say, 3 to 4 hours, and another group comes per 3 to 4 hours. Can we do 4 out of 5 days school week and leave Friday out? So there are so many smart ways of going about this that because we should try to beat this virus and not give up, because there's no guarantee. Well, I hear that when it's as if when the person is at home and moving out of home, the virus does not attack. The moment the child enters the school, that's where the virus attacks. No. So there's no guarantee that when you move your child out of the school, that the child will be safer at home. Actually, when they did the secondary school, with the secondary school who were writing exams, I thought if I had my child were in secondary school, that was the best time to send your child out of home. They were much safer in the school than at home, because at home you could not even track them. Okay, so that environment at that time, where there were so few numbers spread across the dormitory, and they had washing, water, and all those things. Their community that doesn't even have water, but in school they will get. They got hot meals as well. All right. So my advice is that the teachers should be the leaders this time, and real world leaders, not leaders where you call the student to your small common room to punish, but leaders where you practice what you preach for the first time. So right from the time you leave home, you are leaving home, at the back of your mind that I could be the source of an outbreak in my school. All right. If you have that at the back of your mind, you ensure that you protect others. The key about this whole epidemic control is respect for each other.
Okay.
If I respect you, I will wear my face mask. And if you respect me, you wear your face mask. And will not stand up. I will not be offended if you see me and say hi and walk by, and we'll continue the conversation by ourselves.
Very well.
If we don't respect each other and take responsibility for ourselves and each other, we won't get anywhere.
Doc, thank you very much for your time this afternoon. Hopefully, as we go along, we'll get some solutions, workable solutions, feasible ones as well. Dr. Lawrence there, who is a pediatrician, who joined us with his thoughts. Lawrence Osetutu, who joined us with his thoughts there. I'll just read a few of your messages and then we'll move on. We're still talking COVID-19. By the way, Thomas from Nalerugu says mothers should be educated on personal hygiene as well as adherence to the COVID-19 safety protocols, and they should be mindful as to who to give out their innocent children to. Aziz Donla from Wa says pupils in the Upper West region are very much exposed to the virus in the region, especially the regional capital, hence increasing active cases. Masking should be reinforced. Aziz, thank you very much for your message. And this one says, I think that from KG3 to primary 3 pupils should stay at home for now. Frank from Oti region, who is a kindergarten teacher. He says kindergarten and primary 1 to 3 pupils should stay at home for now. This one says, I would like to know the status of hydrogen peroxide as a trending treatment solution, and what are the chances of survival for children infected? Chances of survival, I would have loved to put this question to Dr. Lawrence, but I've lost him now. Hopefully we'll get some answer as we go along. Sorry, Emmanuel Kranting sent that from Wager. Thank you very much for your message. And this message says that parents should be careful to protect their children from the pandemic by using PPEs. Thank you very much, Peter from Afram Plains, Mame Krobo. We teachers and pupils in Bibiani and Riaso Bekwai have not received any masks since school reopened. Nanajwa is sending that. Well, it looks like many of the regions are reporting lack of PPEs from government. This one says, please tell the government to close down schools, especially for our little ones. We can continue learning on the platform. Their lives are important than the school. A worried parent, you signed off as two more, and then we can move on from there. This one says, basic school children in Drapa municipality are yet to receive nose mask 3 weeks after reopening of school. GES and our teacher unions, please help us. And my final message for now will be, this one is asking us to bring in our Upper East correspondent to just tour the Garu township. About 95% of the people here do not take the virus seriously at all. No wearing of masks, and that is also being copied by the student. You say you are afraid. Well, I don't know, but these are some of the issues on the minds of people. Still on COVID-19, it is emerging that more people are dying from post-COVID complications. The medical director of the Greater Accra Regional Hospital, Dr. Emmanuel Sofenyo, reviewed some patients who recover from COVID-19 are reporting back to the hospitals with complications that are suspected to have been caused by the virus. From difficulty in breathing to general fatigue, the post-COVID complications are proving to be fatal. Listen to Dr. Sofenyo of the Rich Hospital as he disclosed this exclusively to JoyNews.
Post-COVID complications, we call them. Oh yes, we have had several patients. You know, the interesting thing, we doctors, we say interesting, but to the patient is not interesting. The issue about COVID is that you can get COVID, recover from COVID, but get what we call post-COVID complications because of the leftover complications that it leaves on you, like the lungs. The lungs is the first place. Sometimes you can get COVID, your test may turn negative, but you may still come back to the hospital with severe lung disease, severe respiratory complications, or severe cardiovascular complications, simply because you've had COVID in recent times. So we have seen this clearly. And there are some people who have survived the COVID, but died from complications of COVID. You know, they've survived the primary COVID disease, but they will go home or either still remain in the hospital. We've had several of such cases who have died with COVID, post-COVID lung complication or post-COVID complications. So again, this is a message to the public that for those who may have survived initially from the COVID complications, the COVID itself, they must remain in close contact with their doctors, continue to attend their medical checkups so that they can be taken through the overall space of time to be sure that they are completely fine. They should not just go back to bed too quickly or relax their guard too quickly, because they may experience some other complications which may be related to the COVID.
Meanwhile, in one of the many manifestations of the virus, 64-year-old Auntie Joyce, who got off the mechanical ventilator at the ICU of the COVID-19 treatment center at the hospital, is struggling to complete a minute-long conversation without gasping for breath. My colleague Manuel Kranting spent a day with her at the ICU. Here is his report.
I tell my daughter that I have to give up because I'm tired.
64-year-old Auntie Joyce in one of her low points as she sits in the ICU at the COVID-19 treatment center of the Greater Accra Regional Hospital. She has just been taken off oxygen after being on a mechanical ventilator for days. As a pensioner who hardly goes out, she wonders how she contracted the virus.
I stay with some babies. Their mothers went to work. If they come back, then I come home. When it starts like fever, my mouth, and I lose appetite. I can't eat, but I used to force to eat. Yes. After that, I could see that if I'm walking, I don't have enough breath, like I want to faint. So I have to take taxi home.
Having taken ill before government's announcement of free testing, Auntie Joyce explains how her inability to afford the cost of testing made her delay in reporting to the hospital.
About maybe 3 days, 4 days. Okay. The first day I told their mother that, in fact, I'm weak. So the following day when I came home and I went to a nearby clinic, and they gave me drip and medicine. I came home later. Then I come back to Kanishi Polyclinic and they treated me. Even they told me that I should come and do the test. And in fact, I'm a pensioner, so I'm waiting for my money on Friday to come on Monday. Before Thursday, I collapse. They rushed me back to the Kanishi Polyclinic before.
While on the ventilator, Auntie Joyce, just like all the others in her ward, was consuming up to 15 liters of oxygen every minute. And now that she's off the ventilator, she's struggling to complete even a 1-minute conversation.
When I was in a polyclinic, in fact, I got tired. If my children carried me kurapo, in fact, I said they should give me air, fresh air. Yes, I know that I was very, very tired when I was in the polyclinic. Oh, in fact, I'm a challenger. Even I was saying that, this COVID, is it an airborne? So, in fact,
you want to relax, just relax a bit. Just relax a bit and catch your breath. And so you're seeing her struggling to merely even talk. And that's the manifestation of the virus right there. Shortness of breath, as you're seeing her, and would have
starting merely as a fever. Her experience at the ICU has taught her that the virus is indeed real. She wants people to adhere to the COVID-19 protocols.
COVID is very real, so they should keep themselves safety. Washing their hands. Anytime they should put on their nose mask. Yes.
This advice from Auntie Joyce cannot be overemphasized, as most recent cases being recorded are severe and critical. Manuel Kranting, JoyNews, Accra.
Still at the Greater Accra Regional Hospital, doctors at the COVID-19 treatment center are warning that the case management at the facility may be compromised if a dedicated oxygen supply point is not provided for immediately to the COVID-19 ICU there. Manuel Kranting again.
A visit to the Greater Accra Regional Hospital at Ridge Wednesday morning will reveal all 16 beds at the COVID-19 ICU there are occupied. Management of the facility had in September 2020 expanded its 8-bed COVID-19 treatment center into a 16-bed ICU. According to Medical Director of the hospital, Dr. Emmanuel Sorpeño, this intervention has not been enough as the latest spike in the country's active cases has put pressure on the facility.
I must say that we opened the new phase of the ICU around September last year, but the place has been relatively quiet. We did not have the numbers until the beginning of this year when we began to have very high volumes of cases. The strange thing or the interesting thing is that very critically ill patients in very high numbers. We started the place with 8-bed ICU, but we have had to expand it to 16-bed ICU currently.
With the increasing number of severe and critical cases being reported at the facility comes a growing demand for oxygen and usage of mechanical ventilators. But delivering on this demand is being threatened by the lack of a dedicated source of oxygen to the ICU.
And as we are talking now, all these 16-bed ICU beds are occupied. And one of the critical needs of patients like this is oxygen support. So they have to depend on high volumes of oxygen. As the technical people have said earlier on, very critically ill patients need about 15 liters of oxygen a minute. So you can imagine, just every minute they need about 15 liters. So that means that in 4 minutes, they need about 16 liters of oxygen, So this is a high volume. So where we have the ICU located, it's not connected to the main block. And so we had a situation where we have to buy oxygen in big cylinders to give to them.
Lead on the COVID-19 treatment at the Ridge Hospital, Dr. Emmanuel Ahiamble, explains to me how the facility is operating under the current arrangement.
This is the manifold, where we have about 10 oxygen cylinders, which are connected to the ICU. So the way they are, when the oxygen cylinders are empty, somebody needs to come and reconnect them. So now there are 10 of them. So it runs in series. One finishes, then it moves to the other one, to the 10. When the 10 are finishing, then someone has to come and change. So that's what we are experiencing. Sometimes, like I said, there could be interruption to finish, and the person comes to change may not be there on time. So it means those who are in the ICU may not get oxygen immediately.
But as doctors here improvise to continue providing uninterrupted care to patients on admission, Dr. Sorpeño says this could portend a real danger for case management.
Normally we buy oxygen before, when we buy oxygen about 25,000, it lasts for some time. But now 2 to 3 days is finished because some of the patients have become oxygen dependent and they are consuming high volumes of oxygen. So we have gotten to a situation where we are spending a large part of our internally generated resource on purchasing this oxygen. So we've now realized that our oxygen plant, we have a plant, so the oxygen plant can be connected to the ICU block so that instead of buying oxygen in cylinders, we can just connect that plant to the block and have free flow of oxygen in 24 hours. The other danger in relying on oxygen cylinders is that when you have a situation where there is a shortage, maybe cylinder supply finishes before you have to install. If you have patients who are critically ill, in that changeover period, you may lose a patient. And so when we have a situation of continuous supply, it's better than a situation of having to rely on oxygen cylinders.
Till the oxygen plant is connected directly to the ICU, doctors here will have to risk dealing with the current arrangement. Manuel Kranting, JoyNews, Accra.
Need you more proof of the realities that we're facing right now with COVID-19? Just stay tuned. We'll be right back. This is still The Pulse with me, Gifty. and Apia. When I return, we'll go to the eastern region. We understand that some 40 cases have been recorded there. Let's get more of that information. Do stay with us. You're welcome back. This afternoon, we'll continue with our regional checks on the COVID-19 situation. Let's head to the eastern region where we're learning of new cases from a school, a private school in Akosombo in the Sojaman district of the eastern region. We're told have recorded 40 cases out of the 19, out of a total of 500 samples taken from the school. 40 students tested positive and have been asked to self-isolate. Health officials say all the students are asymptomatic and are responding to treatment. My colleague Maxwell Kudeko has been finding out more. He's joining me on the phone. Hello, Maxwell.
Hi, Gifty.
Maxwell, what do we know about this school?
Well, the school is a private school in the Akosombo, in the Sojaman district of the eastern region. Has officials do not want to disclose the name of the school, but we know that it's a private school, a big school in Akosombo. Now, one student tested positive last week, and then health officials needed to do a contact tracing. So they sampled about 500 students, and then they picked their samples for test. The test turned out to be that 40 out of the 500 students have tested positive to COVID-19. We are told that almost all the students are asymptomatic, so it's very difficult to identify some of these COVID symptoms from them. Director of Ghana Health Service, the Eastern Region, Dr. Winfred Ofosu, tells me that all the 40 who tested positive have been asked to self-isolate, and then they are responding to treatment accordingly. The other students have also been asked to adhere to the safety protocols religiously. So statistics tells us that the Sojaman district is the second most affected district in the eastern region when it comes to the COVID-19 infection. They have 70 cases. So for out of the 70 cases, 40 are coming from this private school that was tested last week. The New Zealand South, that is Kofodia, tops the league of COVID districts in the eastern region. So this is all that we know about the infection in that the said private school in Akosombo in the Sojaman district.
Well, you've also been looking at compliance when it comes to the safety protocols. You visited the Agatha market. Tell us what you found.
Well, a couple of the traders were seen in nose masks. A few of them also had their masks beneath their chin. They have resolved, mostly the traders, to somehow adhere to the protocols. But people who have trooped to the market to do business, most of them are not in nose masks. Let's listen to some of the traders and a few people we met at Agatha market.
Coming from, and we really need to take care of ourselves by adhering to the COVID protocols. Those who are found flouting the COVID protocols should be severely dealt with. Observing the COVID protocols would help us all.
Observing the COVID protocols is a daunting task, but we need to abide by them. As you can see, we are observing the social distancing protocol and wearing our face mask.
We are strictly abiding by the protocols, and we turn away those who come to buy without face masks, because we have to follow the directives by the government by wearing our face masks and washing our hands regularly.
Well, Maxwell, looks like mixed reactions there, but at least for the majority of those that you spoke to, they seem to be very mindful of it. What are authorities saying or doing about the situation in your region? Hello, Maxwell? Okay, it looks like I've lost Maxwell there. But let's talk to Dr. Winfred Ofosu. He's a Regional Director of Health Services for the Eastern Region. Doc, thank you very much. Can you start by giving us an update on the COVID situation in your region? My colleague has given us a few figures, but do confirm for us. Hello?
Hello.
Yes, Doc, thank you very much. I was asking you to take us through the statistics, your COVID statistics. Well, my colleague has just told us a few things, but do confirm for us the figures. How many cases have you recorded so far?
Yes, so far for the 2021, we've recorded 322 cases as at 2nd February. And the total active cases that we have now is 158. Okay. We have also recorded 9 deaths. So those are the best statistics for Eastern region.
For now. So this afternoon, we're learning that a school in the region has recorded 40 cases. What can you tell us about that?
Yes, there's a school in Asojama who has recorded a number of cases. They've recorded 42 cases, but there are still some results which are pending. But most of them are asymptomatic, and currently they are at isolation in the school. They are all in good condition.
42 cases, you said?
Yes.
How did we find this out? Was there some kind of mass testing in the area or
yes,
was this?
It was a mass testing that was done. One person had symptoms and was tested and was positive. So they decided to screen the entire school, and they tested over 500 students. So that's how come we had that number. And most of them didn't have any symptoms. They were asymptomatic. But because the screening was done, they were picked out. That's why we have such
Which school is this?
I have to try and get it for you.
Well, I mean, if there's a reason why authorities do not want to mention the name of the school, because we've been trying to get this. If there's a reason, we can take an explanation, I think.
No, I have to get the name of the school for you. I mean, it's in the Asojama district.
So are the students there, are they...
the students are in the school.
Are they teenagers? Are they teenagers or are they children?
Come again.
Are they teenagers or are they children?
Children, as to which age are you referring to?
Yes, which was the age range of the students we're talking about here?
I can't get you exactly what you want.
I want to know the category of people who were tested, out of which 40 are positive. Are they younger people? As in, what's the age range?
No, they are students.
Okay, I get that. Very soon we'll figure that out. But in terms of compliance, my colleague has been to the market. Some good, some good work being done there. Some of them seem to understand the exigencies of the time. What is your plan in terms of communicating the seriousness of this outbreak to the people, and is it working?
Yes, we'll continue to talk about the need to comply with the protocols. Wearing face masks once you are entering the public or you are in a space where there are other people, and then as much as possible ensuring social distance. Yes, speaking up, but largely a lot of people are still not strictly adhering to this. And that's the challenge, because we know even as the new variants come into the stream, these are much more infectious. So people are more likely to get infected once they are exposed. So they need to adhere strictly to the protocols is even much more important than before.
I'm asking whether this message is being sent across to the people and how.
How we are sending the message?
Yes, I mean, what is the...
Yes, we continue to do education in the health facilities and also in the communities.
Okay, because I've just spoken to a pediatrician who was commenting on what we are beginning to realize is more children, testing, or more children being tested positive or having tested positive for COVID-19. So one of the points he made was how information seems to have been centralized, but the need for that information to be broken down and taken to the people for they themselves to spread it among themselves. Is that a strategy you are considering in your region?
Yeah, the community, we give the information to the community, so I don't know why he's saying that the information is centralized.
No, it's not for the Western region. It's not for the Eastern region. He was talking generally.
We met with the district directors and medical students, and we discussed all these things. The importance of making sure that our people in all communities receive the message, so they adhere to the protocols.
Let's talk about your case. Okay, please go ahead.
So the information is not centralized in Sekufroad, but it's gone in all the districts. And we have staff visiting the districts, conducting public health activities. And part of it is to carry education, risk communication on COVID activities. So the information is not centralized. Okay, let's look at your case management so we can wrap up, Doc. How are you managing the cases? In Accra, here in Accra, for example, we're told that there is a lot of pressure on the health management facilities. We're told that our facilities are full. What is the story in the Eastern region? How are you managing these cases? Most of our cases are on home management. We have 5 cases which are on admission. So as at now, we do not have much pressure as far as managing cases in the health facility is concerned.
That sounds good. What is the story about PPEs for health workers as well?
The health workers, yes, quite a number are also part of the statistics I gave out. And we are encouraging them. We know that it's not very, comfortable wearing the protective gear throughout when you are working. But it's important, for us to adhere to it so that we can be safe. So a number of them have gotten infected. So they are currently under quarantine.
How many of them,
sir? They are doing well.
How many of your staff have tested positive, sir?
Then I need to refer. I don't have that figure here.
All right, no problem, sir. Thank you very much for your time this afternoon.
Okay.
And that's the Eastern Region Director of Health, Eastern Regional Director of Health Services, Dr. Winfred Ofosu there. So confirmed 42 cases recorded today in the Eastern region in a school. We're yet to know which school that is. He also says that some of the health personnel have been infected and they are in quarantine. He's unable to give us a number right now, but they have only 5 cases being managed at a facility. All the rest are being managed at home. Waste bins are placed at vantage points in communities to prevent littering. Although there have been several innovations to waste bins, persons with disability and children sometimes find them inaccessible. In an era where bins have become integral in the fight against the spread of COVID-19, a student of Obuasi Senior High Technical School have designed a touchless bin. to tackle the situation.
We came out with this automatic dustbin, which disables children, especially disabled. When you wash your hands and get close to it, it automatically opens for you to put whatever you want to put in the dustbin. And someone will ask, what are the components or the parts in this dustbin? We use an ultrasonic sensor, which is waterproof, and also the Arduino board, and we have a motor driver here inside.
This can be used in offices, schools, hospitals, banks, etc.
The team hinted of plans to add a solar panel to the bin to make it accessible to people living in communities without electricity. The team of teachers led by Solomon Nko says the project needs more funding to begin commercial production.
We've also have in mind to make it in sizes so that people who want to buy them, they can buy. And then also we are also throwing this to the general public, that anybody who can come to support us, we will try to make them as many as we can to let the general public have them.
Headmaster of the school, Ernest Riafe, is confident the Robotics Club will come up with more innovations.
And I hope and believe that that is not going to be the end. We expect quite a lot from this team. As we know, necessity is a matter of invention. So as we progress in life and we face challenges, I believe our team will come up with much more of such inventions and technology, if you like.
Unlike other dustbins, the Touchless bin by the Boise Sector Robotic Club is disabled and child-friendly, and you can be assured COVID-19 is well covered.
Anita Jogues report for JoyNews.
Now, 3 children who survived the deadly crash on the Tamale-Bupe Highway, which killed 20 people, are stranded as their mother and 2 other siblings died in the accident. JoyNews is learning 18 bodies have yet to be identified. Police say its preliminary investigations point to sleep driving as the cause of the accident. Isaac Nonya is our correspondent. He's joining me for more. Hello, Isaac. Isaac? Isaac, you're muted. Isaac, do unmute and let's try this again. Okay. Well, I will get to Isaac in due course and try and hear him. We can't hear him at the moment. But more than 40 persons who were injured in that accident are still receiving treatment at the Tamale Teaching Hospital. My colleague Martina Bugri is there for us. Hello, Martina.
Hi, Gifty.
Martina, let's start with the 4 people who are in critical condition. Are they any better now?
What I'm told is that it will take a while, but they are in stable condition. They had injuries in their head, some parts fractures in their, one has fractures in both legs, the other has one in the arm and then the leg. I must say that the injuries are very serious. One tried talking to me, but the conversation wasn't coordinated. He starts from one point, goes to a different point, come back, and on and on, you know, it goes forth and comes back. And so I was told to allow him, that he needs time. I was told that he will be transferred to the neuro surgeon department where they will take better care of him, because that is where they will be dealing with him. The others, I'm told they will be taken to various departments of the hospital where they would receive treatment. What we do know also is that 5 people have been discharged and then 11 are still on admission, but they are all doing very well. With the dead bodies, we are told that 10 have been claimed, 4 have been identified, and 4 yet to be identified, Gifty.
Well, the 4 that are yet to be identified, what is the situation? Why are they unable to identify them? Does it mean that nobody has come forward?
Exactly. So nobody has come forward yet to claim. And so they are holding on, hoping that people would pass information, and then people, those who think that they have relatives who have not arrived at their destinations, will make a follow-up to the hospital and probably identify them. I spoke to some of the relatives. One said he got a call from the auntie who said that was en route to Garu and so was involved in an accident. So he should try and get to the hospital and find out. He got to the hospital, he was told to go to the morgue, and that's where he identified his relative. There was another lady who lost the brother. She couldn't control herself. She broke down crying, and all she could say is the brother is dead.
What about the 4 people who have been identified but not claimed? What reason are their family members? What reasons are their family members giving for leaving them there?
What I gathered from the morgue was that they have identified and they need to go home. Per their religion, they would need to perform some rites and then they can come back for the bodies. And so they are waiting for that to be done. Then they'll return and pick the bodies.
That's a very sad story there, Martina. But let's speak to, you've been speaking to some of the hospital officials, Martina. What more do they say before we hear it from themselves?
I spoke to Misbah Mohammed. He's the public relations officer of the DPH, and he says that luckily for them, no life has been lost since they brought them in. And he talks of the discharge and those who are on admission now.
Not recorded any deaths because 20 were brought in, like I said, 4 critically injured and 16 mild injuries, and 5 have been discharged with 11 on the admission, and the other 4 who were severely injured are also stable currently and will be transferred to the various wards for further management.
There have been conflicting figures of the death toll. What's the death toll, if you know?
As far as we have on record, 17 people were brought in there, and later one also was brought in out to the 17, making them 18. So we have 18 bodies at the mortuary.
Have their relatives turned out?
Yes, as of yesterday, 2 were buried, according to Islamic custom. They were Muslims, and they were buried yesterday. And this morning, some relatives have arrived from various parts of the country to identify the bodies. Currently, that identification is ongoing.
That's the official at the hospital there describing this to you. How are they managing this alongside COVID-19? Tell us, what has become of these young children who lost their parent and their sibling in the accident?
I think I must say there's good news now for those children and all other patients who are on our mission at the Holistic Medical Hospital. I will speak all of them, including those other 3 children whose relations were nowhere to be found, have been identified and then discharged. We know 2 others who were still needed medical care were transferred to a terminal teaching hospital. I spoke to the medical director of the Holistic Medical Hospital, who told me that it got to a point that they have to issue the patients who were still there due to their relatively stable condition with some forms to relocate to their various hometowns and attend further medical attention in case there is the need. But they said everything was under control, and those they have doubt about the condition, who happen to be 2 people, are currently at TTH, where doctor will assess the situation and, if possible, also discharge them.
Well, that's good news. That's good news to know. But is there any other updates that you can share with us from there?
Yes, the update is that 21 others are still on a mission at the Bupe Polyclinic, where doctors are equally still assessing their situation. And my information on the ground at the Polyclinic is that between now and tomorrow, things remain the way they are likely to also be discharged.
Okay. Well, that's good news. Well, we were told yesterday by the National Road Safety Authority representative there for the Northern and Savannah region that some investigative team will be put together. Has that happened?
That has not come to my notice yet. You know, okay. They are equally collaborating with the police. And one of the conditions or the points the police will be driving home has to do with the double system drivers, where mandated or it will be mandated to carry along 2 drivers. In case one is tired, the other one takes over. According to the police, that one is non-negotiable. The National Road Safety will need to consider that one so that together they will manage the road and then the carnage on that particular stretch of highways.
Thank you very much, Isaac. Isaac Nonya there. He's our Savannah region correspondent. Meanwhile, director of the Building and Road Research Institute, Dr. Daniel Asensu Gambibi, says the percentage of Ghana's GDP spent on these situations is worrying.
Our GDP is projected to hit $50 billion by the end of 2020. And road traffic accident cost us 1.6% of our GDP. So in terms of the numbers, we are talking about $800 million. That is the cost to our nation in terms of accident. So if we use even 25% of that, or a quarter of that, we are talking about $200 million. So if you invest $200 million in road infrastructure or measures to prevent accident, you are only using a quarter of what you would have lost, and that is not even enough for us. So that is, in terms of numbers, that is the cost to the nation, $800 million in terms of road traffic accidents, and it's huge. So if you translate this figure, this GDP in terms of the cost to our nation into figures, and we can know the figure, then we know how serious and how much concern we should be in tackling road traffic accidents.
But is it not interesting that we have a number of interventions for other diseases?
Yes.
Non-communicable diseases, even with this COVID. Why are we not getting this same commitment from our policymakers?
That's interesting. As you have rightly said, road traffic accident is taking more lives than what COVID is taking. And it's a serious public health concern. So you have said that right, that we need to be even more concerned when it comes to road traffic accidents. It's probably because we don't know where COVID is coming from and that kind of thing. But once we're able to translate these figures to the policymakers, then they should be alarmed themselves, because they can also be victims just like we are having in COVID. So it's something that we have to consider seriously. We have to commit resources in making sure that we curb road traffic accidents. Probably the message has to be sounded better than we are doing now. That look, these are the figures and this is the cost to the nation, because COVID is nowhere near road traffic accidents when it comes to mortality and morbidity.
I don't have words to wrap that up, but let's take a quick break. We'll be right back. You're welcome back. Now, some residents of Boho Adumako in the Effijakwabre South District are resisting eviction from areas marked as buffer zone for quarrying. Hundreds of homes within 500-meter radius of the quarry are earmarked for demolition without compensation, since the assembly described the area as illegal settlement. Hundreds of residential properties in the Boho Adumako community in the district are to be pulled down to make way for the mining of stones. Love FM's Nanaya Ojima with this report.
Henry Dapa, a teacher, has lived in his 6-bedroom home here at Boho Adumako for 5 years. The house is sited about 200 meters away from the quarry. He had no building permit, but he wasn't stopped at the period of construction.
Apparently, they don't have a chief now, so it was Abusapani who is taking care of the land and everything here. So we went to him to inquire about it, and then they sold it to us. We have the papers, everything intact.
Hundreds of houses completed and others at various stages of completion, sited within 500-meter radius of the quarry, are marked to be demolished. The property owners are served with notice to vacate their homes for the quarry to start operations. But these landlords are claiming to have legally acquired the lands.
As young as I am, if I have a single bedroom house and the assembly wants to demolish it, then they have to demolish it with me in it.
Allocation paper me call land me kwaje permit o mo ka kire me say o ye nye half plot je se me ni nipa na obo hye no e na be ye nipa no so asa fi no to foundation
no one ever came here to stop me from building my house. Why now? They should compensate us before they pull it down.
As for me right now here, I have 6 bedrooms. So you cannot come and pull it down unless you compensate me. Even the site belongs to the government. We don't have any problem with it. Unless you come and compensate us.
Custodians of the land, the Boaho Adomakus too, has denied selling the land to the occupants. The family, however, believes occupants of their houses should be compensated. Opokuwari speaks for the family.
And they said they have designed a new layout. And the layout that they have designed, they have demarcated this site as a buffer zone. And it has up to 500 meters. All the structures that's within the 500 meters radius, they are going to pull it down. What right do they have to come out that they are going to pull down structures without anonymous approval? And what license or concession has the said Edu 2-man got?
The last quarry activity here was in 2006, after 3 different companies took turns to mine the site. Inactivity is clear on the machinery on the site. The assembly describes all these houses as illegal settlement since the area is buffer for the quarry. Christian Edupoku is district chief executive.
The compensation will come when the assembly, out of maybe negligence of one of his staff, might have given the person a permit. Then genuinely, we, the assembly, must pay for the cost of that person's building. Other than that, anybody who is sitting there without permit, he must lose whatever he has over there. And they build in the night.
For Joy News, Nana Ojima reporting.
Residents of Omampe, Boinso and Enchiko, 3 communities along the Elubo-Enchi Road in the Awawin municipality of the Western North region, are accusing a mining firm in the area of destroying the environment. They claim the company has gone contrary to the mining agreements with them prior to entering their communities. They want government to force the firm to live up to its responsibilities or to stop them from operating. More in this report by Natalia Kwanza.
We had some mining company who told us they were here to do mining. So the community agreed with them, thinking it was mining. But later we discovered these people are doing illegal mining.
Of course, yes, Crestford Ghana Limited. I am the one of the people that brought Crestford to Boenso society. They came and per the agreement that they gave it to us, it means that they are not coming to do illegal galamsey. But behold and hold, the work at Akko, the work at Amape, what they've done to Akko and Amape, it is not easy.
John Money, a cocoa farmer, and others show the Joy News team the level of environmental degradation which they say has affected water bodies used for irrigation and daily purposes.
You don't get place to fetch water to drink. And moreover, when they came here, they promised to give us light. They didn't give us. Why they are having a transformer there? If they fail all the agreements, something like if you want to make spraying, you can't get water to make that spraying. I can say a mad side where you can get the water easily.
The residents are demanding an immediate end to their operations. The front of the mining firm is, however, seen divided as two parties, both claiming ownership of the concession, argue over who is to blame for the level of destruction. Both parties agree to illegalities which has affected the communities. First, Nana Kwa, who claims to be a resident director of the firm.
We own this concession, and then some years back we entered into an agreement with a Chinese company called HK Zhengding. We abrogated that contract for part fit on their part. We have realized that even after the abrogation, some of their associates keep on mining on our concession. In fact, in a way that is wanton degrading of the environment, and we will be held responsible at the long run.
And here is Henry Okum, who also claimed to be operations director of the firm.
They themselves went and brought two people, those people who are working within the water that the government doesn't want. They are working there.
Several calls from the community members and individuals along the stretch may be yielding some results as the task force from the Small Scale Miners Association heads to the community to ascertain the extent of degradation. The 30-man task force and some association leaders see first-hand open pits and devastated environments en route to the mining site. They arrest this Chinese national and his Guinean accomplice, and the two lead them to the premises of the mining firm. Heated verbal exchanges ensue for hours as private security men of the firm refuse to allow the task force and their leaders entry.
We would like you to insult your voice. We are not here for violence. We are here for understanding. We want to go inside. We don't want to stand outside. That's why I spoke to him and I said, let's get inside. We can sit down with you while you are doing legalities here.
Razak Alasan, communications director of the association, declares the firm temporarily closed.
So right now, the concession is now into contention. Two people are claiming the same concession. So the Council of Elders will sit down, digest it, and know the person who owns it.
Joy News in Athalia, Kwanza, Western North Region.
Now, as universities have started a new academic year, most students have had to struggle not only with compliance to COVID protocols, but also with online learning. But how feasible has it been for students when it comes to Wi-Fi connectivity? Judith Aochitando reports some students are worried about the new mode of learning.
COVID-19 has changed many things, from the wearing of nose masks, no handshakes and hugs, and basically an end to communal living and even the mode of teaching and learning.
We can't see the virus, we can't feel it, we can't touch it, but it's there. So you always, your life is now pinned to the nose mask.
Schools in Ghana, just like elsewhere, were used to face-to-face interactions prior to the pandemic. This has changed. Online learning comes with a cost. Costs of data, gadgets, and many others. In the University of Ghana, the school is running a full-blown academic semester online, which gives students no other option than to grapple with access to Wi-Fi connectivity. But is this really the situation?
At first, the online studies was a good thing. But when we get to school, we realize the Wi-Fi is not that much strong. Okay? So you'll be in class and then the network will be up and down.
My affiliation was Legon Hall Annex A, and trust me, I'm seriously facing this Wi-Fi connection.
When we were coming to school, initially management told us that there will be strong Wi-Fi connection on campus. But when we came, there's nothing like that here.
A level 100 student who contacted me that his Wi-Fi connectivity is very poor, and for that matter, he has been buying data for a day 30 Ghana cedis.
Like now, I'm having a class. It's not so well for me. So we are finding it a little bit hard, but we are managing.
Bad internet on campus means extra costs to students.
Financially, you see, the parents in the house, maybe when you tell them, they will not really understand you. So you have to maybe use your own pocket money and those things to do it.
For a week, I can say I spend almost 200 cedis, yes, on data for a week.
I'm a student, and if let's say they give me 100 cedis or 200 cedis per month, and I'm to use 25 Ghana cedis every week for credits. That means I don't even get time for my own upkeep.
The students' leadership is worried. Kwame Ntofianko is president, leading the school student union.
We had a meeting last week, and in our meeting, we made them understand that before students had come to campus, they gave us the assurance that it would make the system perfect. But as it stands now, we've not seen, the Wi-Fi expansion come to fruition as we actually anticipated. But they should try as much as they can to ensure that they improve upon the Wi-Fi connection on campus. That is why we gave them a timeline between last week, Friday, and probably by the close of this week. So let's see how far that would go. But we would make sure that they will do as they have promised us.
In 2020, the school provided some data services for online learning while schools were shut down. As to whether this system will be reinstated remains unknown. Judith Awotretando for JoyNews.
And we do Let's Talk Showbiz, which is how we wrap up the entire show. There's more news at myjoyonline.com. Do log on. And this video is on demand on our YouTube channel. My name is Gifty Andopia. Have yourself a good evening.